Hello, everyone. We're hanging on. In just a moment, we'll get started with the program, but I wanted to start live streaming so that as you are attending the Rook product review and how you can be a help for preventing hospital-acquired pressure injuries on your ECMO and vasopressed patients, along with how to protect on falls and fresh BKAs and upper extremity. So we'll get started in just a minute, making sure that the live feed is going through for you. I hope you're enjoying the conference. I just finished listening to Frank and Dr. Rudolph on how to avoid, unavoidable and avoidable pressure injuries. Gosh, that was really a fascinating talk. I really enjoyed that one. Check my clock for just a second. Okay, 12 o'clock, we're on. Thank you so much for coming to the educational seminar. I'm Keith Ware, and in this review, we're going to look at Rook products and how they can be a help in preventing your hospital-acquired pressure injuries in your ECMO and vasopressed population, as well as protecting your fresh BKAs from falls. And then we'll look at upper extremity hand ischemia to see how we can minimize ischemic events in your hands. So taking a minute to outline the magnitude of the issue, Wound and Ostomy Management in November of 2016 did a review for patients in the ICU and hospital-acquired pressure injuries. They quoted between 10 and 41% pressure injuries will occur in the ICU. And that meets with what we've been hearing from the other presenters today, that the ICU, medical ICU, are really the most dangerous areas for your patient population. Also in that ostomy wound management, they indicated that 14% of those pressure injuries will occur at the heel. Then in critical care, July of 2019, they looked at VA ECMO patient population, and they found that ischemic limb complications occurred in 8.6 to 12% of the patients that were on VA ECMO. And then Journal of Vascular Surgery went on to detail in April 2017 that patients that were on ECMO and did not have a distal perfusion cannula, a third of them had acute limb ischemia, which could result in necrotic toes, fasciotomies, and they even reported a 0.9% incidence of amputation. So the question becomes, what can Rook products do to help protect this really fragile population? And the first line of defense is a Rook Boot, which has been around for 33 years. And as you look at it, you can absolutely see that it is a well-insulated boot, both at the toe box and at the calf. And what that does is it gives a natural warmth because you prevent the heat loss and a resulting vasodilatory cascade. And at Mayo Clinic, they published a paper in Angiology, May of 1987. And I know that that seems kind of old, but the premise is absolutely applicable today, in which putting on a Rook boot on ischemic post-op limbs, they were able to demonstrate an increase in TCPO2s on those ischemic limbs of 5.3 millimeters of mercury in TCPO2. So just to put that in context, we know that it's well established within the TCOMs that you want to have between 30 and 40 millimeters of mercury pressure in your TCPO2s to be able to heal a wound. So if you've got a vasopressed patient or an ECMO patient that is teetering right on the edge because they've got limb ischemia, keeping them warm can do an excellent boost in that regional perfusion. And in fact, we hear routinely, as we do in-services around the country, nurses will say to us, that patient was so cold we couldn't pick up pedal pulses, and then they'll put on Rook boots, and after about an hour to 2 hours, then they can Doppler those pedal pulses. So the whole idea of protect that limb from heat loss, and you will create that vasodilatory cascade. The next point would be, as NPIAP has said, offloading and redistribution pressure is absolutely vital. So Rook boots have always had offloading in them. However, there's been a perception that we didn't offload enough. So within the last 6 months, we have added a Comfort Plus pillow top layer with a gentle slope to a deeper heel cup. And what we were able to do is the development of this, we measured the 3 body types: endomorph, mesomorph, and ectomorphs. And we did those pressure mapping studies, and we were able to demonstrate 100% offloading of those 3 body types. So now you can rest assured that your Rook boots, combined with the warmth and perfusion, you have 100% offloading of your range of patient types that you're going to encounter. You'll notice that we have a foot drop wing, and physical therapy colleagues around the country have said to us, you know, after about 3 days is when a patient that's been immobile starts to become at risk for foot drop. So right out of the packaging, the boots are set so that you can keep your patient in a relaxed, neutral dorsiflex position so that they won't develop foot drop. Also, there's a wedge. And with that anti-rotation wedge, whether it's external or internal, because it fits on both sides, that's really important for your ECMO patients when they're cannulated, because the position of those cannulas makes a big difference on how you can have flow in that circuit. So there's an anti-rotation wedge to make sure that that patient's leg is staying in an upright, neutral position while they're cannulated, and you've got then good flows through that circuit. So detailed all sorts of features and benefits for you, but what are the outcomes that you can expect with Rook boots? Allow me. So we've got a really nice white paper from Riddle Memorial in which we were looking at their ICU patient population. And what we did is we ran a series of 50 patients with 100 limbs, and the inclusion criteria was a Braden of 14 or less and albumins 3 or less. Now, granted, in some of the talks just recently, that albumin and pre-albumin are sometimes hard predictors to determine the nutrition of that patient, but at that time, that's what we had. The other comorbidities that were included was a diagnosis of PAD. They were on vasopressors, or they had a current arterial pressure injury, or a pressure injury anywhere else on their body. So I'm giving you those details on that inclusion criteria, that these were not cream puff patients. And happy to report on those 100 limbs, we had a 0 incidence of heel toe injuries. But the other thing that was really fascinating as we looked at this population, there were 30 patients that had 39 pressure injuries on their lower extremities. And with the combination of Rook boots and excellent nursing care from the folks at Riddle Memorial, we had 66%, so 2/3 of the stage 1s healed in 4 days or less, and the remaining stage 1s resolved at 12 days. Also, 40% of the stage 2 healed by 9 days or less, and the remaining showing marked improvement. Plus, there were stage 3 and stage 4 pressure injuries, and all of those in that 12-day period of time had reduced their size by 75%. So it really is a testament to excellent nursing, of course, but the use of a Rook boot to enhance perfusion, offload, and redistribute pressure to help heal those pressure injuries, which are so frequently present when you're caring for ICU patients or your ECMO patients. One other outcome I can relate to you, as we were developing the Comfort Plus pillow top layer, we were working with Abbott Northwestern Hospital here in Minneapolis, where I'm presenting to you live from. And in their CV ICU, we had a series of 145 limbs, and those patients were related to ECMO, complex cardiac, as well as complex vascular. Plenty of pressors used, and then, of course, being on ECMO. We had one stage 1 pressure injury at the Achilles in that exceptionally compromised patient population. And what that came out to be is slightly less than 0.7% of a pressure injury rate, which is tremendous. As part of NDNQI, you're well below the benchmarks. So that's terrific outcomes. With that, we'll now take a look at the Rook BKA residual limb protector. As we were developing this device, we were talking to vascular nurses and surgeons, and what they were asking for is, give us something that can protect our patients when they fall. It's not a question of if, it's a question of when. And that was really borne out by a paper that I was able to research and find, Journal of Physical Medicine and Rehab, February 2017. They documented a 20% fall rate in the acute care setting and between 40 and 60% falls in the community care setting. So you know they're going to fall. And I hope you can see this. There's a nicely padded distal end cap. And in our device, we are up to 29 reported falls in the Rook BKA protector. And those patients did not dehiss. They didn't convert to an AK. You didn't have to evacuate a hematoma. And that's a massive win for the patient, of course. But you also have to consider, as part of that 30-day DRG window, you don't want that readmission. And we've been able to help prevent those readmissions coming back because they're not hurt. They're in good shape. So that's that padded end cap, and that's what our device can help do with regard to fall protection when your patients, your fresh BKAs, ultimately fall. Also, there's a splint in the back that is then augmented by nice padding with our signature synthetic lambs so that you can have protected fabric on that really friable dysvascular patient. And we've also are going to have that vasodilatory effect. So we're going to warm up that residual limb. And to demonstrate that for you, there's a real nice write-up that we had in Wounds, August of 2018, in which Madigan Army Medical Center was using ICGA. And for those that are not familiar with ICGA, that's taking Indocin green dye, which is a water-based dye, not non-nephrotoxic, so it doesn't hurt the kidneys. And under a certain wavelength of light, it fluoresces. So it's a beautiful way in which to see what kind of perfusion you have in an area of interest. Plastic surgery uses it a lot to determine if they've got enough perfusion in a flap. So in the series of patients that we did, one of them was a fresh BK. And in looking at that residual limb, the baseline picture, you could barely pick up any fluorescing, which means there wasn't much perfusion in that residual limb. Then after putting our device on for an hour, they started to warm up and you saw it fluoresce a little bit better. But after wearing our device for 2 weeks, oh my gosh, the picture of that was just gorgeous. You had a beautiful definition of that residual limb, really well perfused. So that is what a Rook BK protector can do, giving you the full scope of fall protection, contracture control, and boosting regional perfusion. The next item would be the Rook Mitt for your upper extremity hand ischemic patients. And probably the easiest way to detail the impact that a Rook Mitt can have is a case presentation from Sanford Health in Sioux Falls, South Dakota. They had a patient that was on dialysis, coded. They put her on therapeutic hypothermia, but her comorbidities were Raynaud's and scleroderma. So you can just imagine what kind of pressure injury risk that patient was at when you cool them down. And oh my gosh, it was really quite nerve-wracking. But what they did is they put Rook Mitts and Rook Boots on that patient, ran the course of therapeutic hypothermia, patient came off, and there were no pressure injuries to the hands or to the feet, which was wonderful. So that's the great news on that. Also want to detail for you, you can open up the middle. That way, if your patient has pulse oximetry, radial art line, they could have IVs, you can set their hand in it, make sure that it's not clenched, so you can open it up, and then you can seal around the hand, bringing that Velcro and that D-ring around just to close it up enough so that you can seal in the warmth that's generated, because you don't prevent heat loss. And that's what your Rook Mitt is available for your upper extremity ischemia patients. So as we start to wind down, I'd like to do a recap. And we all know that you've got plenty of boots to choose from. And the vast majority of those boots will do an excellent job for you to offload heels. However, when you've got that ischemic population, that's where your Rook boots will be an ideal choice, because you're going to have excellent offloading, that natural warmth boosting vasodilatation, foot drop prevention, as well as that wedge to keep them in upright neutral position. And if anybody is interested in doing a quality improvement project, please reach out. We would be happy to be involved to see what role we can play to move the needle on improving results in your ICU with your vasopressed or ECMO patients. Also want to let you know, we have a skin check mirror. So if you stop by the Rook booth, visit us at the chat line and register that way. All you have to do is just type in and let us know that you're interested in this mirror, and we'll be happy to send it to you. And I want to make one last review as we look at the surge in COVID patients. And there's a growing body of evidence that there's a thromboembolic cascade that occurs with the severely affected COVID patients. And there's a nice paper from the Annals of Vascular Surgery, August of 2020, in which it's acute arterial thromboembolism in patients with COVID in the New York City area. And this was done at Northwell Health System. And I've just come to learn by reading the paper that they're one of the largest within New York. They were reviewing 12,630 hospitalized patients with COVID, and 49 of those developed thromboembolic cascades in a variety of areas, distal feet, hands, etc. And I want to throw out, I've had one wound care nurse who reported back that she encountered some COVID toes, put Rook boots on that patient, and then several days later, those purplish blue wounds resolved. I don't know how we're going to do in a massively embolic scenario, but it's my hypothesis that if we can enhance the distal perfusion, open up those vessels, dilate them a little bit, and keep it moving, that thrombotic cascade that is occurring with those COVID patients, maybe we can be a help. And if you need samples, let us know. If you want to do a case series because you're getting inundated and you're seeing those patients, we would welcome the ability to partner with you and supply you with those boots to see what kind of impact we can have with that embolic cascade that occurs in a subset of those COVID patients. So with that, I'll pull my chair up and see we have a live chat. So if anybody would like to type in a question, I'll happily reply. And if for some reason the live chat's not available for you, please stop by the Rook booth in the virtual exhibit hall and send us a chat question that way. So thank you very much for joining us. And let's see if there's any questions. I think what I'll do is I'll stay on for probably about a minute. That way, if anybody has something, it gives me a chance to respond. I hope everyone's enjoying the WoundCon presentations. I have to say, I really admired the topics that have been presented, and the presenters are really quite lovely. It's very knowledgeable. Well, I don't see any chats coming through. So what I'll do, I'll wish you a good day, and thank you for stopping by the Rook booth, and welcome any questions that you have. If you're interested in samples or you need that skin check mirror, just let us know and we'll send that out to you. Well, thanks so much for watching. We sure appreciate that. Bye-bye.